That's right, Morgan. Hospitalizations are continuing to rise, which is expressing concern from the administration here at Mosaic Life Care. One thing that is true is only 2 out of 27 people have been fully vaccinated. So that shows that the vaccine has had effectiveness so far. Yeah, in the last few days, there's been a lot of talk about masks, and the mask ordinance has now been repealed. And here in St. Joseph, it was the first day. And inside East Hills Mall, people did not have to wear masks outside of the stores in the mall, but many of the stores required masks still. As I'm walking in from the parking lot, usually people would be walking into these doors to go into the Gordon's to shop. But now this mask required and social distance, that's because of COVID-19 vaccination clinic. This has been something that the community has wanted for a long time. And now phase 1B is set to start and 100 people are going to be vaccinated here. And this will be the future vaccination site as we move forward. A lot of senior living facilities like this one, the Gower Convalescent Center, have experienced an outbreak in cases and have seen deaths resulted in that, which have contributed to countywide COVID-19 death numbers. As well, 78 in Springfield, 81 in Little Rock, 75 in Oklahoma City. Futurecast shows those southerly winds will continue to bring heat to our area, as this is what it looks like right about now. As we move into tomorrow, we'll see a little bit of clouds come in, and then into Sunday, we'll see our first chance of rain. Steamboats used to be all over the Missouri River in the late 1800s, taking people and goods west. And here in Atchison, that was no different. Yeah, and I'm here with Bill Faulkner, state representative, and you are talking to business owners. Kind of, why is an event like this important, especially off the special session, getting ready for special session, some of the big kind of topics that have been on hand here at Jefferson City?
Well, I think it's important that you stay in contact with the businesses here locally to where you still have a kind of an idea what's important to everybody around here, because you're dealing with statewide issues, but you also want to make sure you concentrate on your local businesses and keep them in your thoughts. I mean,
on the other hand, what is something that you kind of are keeping them informed in, and what are some big things you'd like to see done here at Jefferson City at the state level?
Well, we got the internet sales tax passed, so we're waiting for the governor to sign that. I thought that was very important for our local businesses to put them on a level playing field with businesses outside of our state. So I think that was very important. And now we just have to concentrate on some of the things we should have got done during session. And it was disappointing that we didn't, but we have to go back and get them done.
COVID-19 vaccine has 90% effectiveness. All around the country, there's room for optimism, as well as here in the state of Missouri, where a vaccine rollout is on its way. The Missouri Department of Health and Senior Services has sent out a plan that is over 100 pages that details how the vaccine will be administered in 3 phases, with the first phase expected to be ready in December and available for frontline health workers and long-term care facilities.
I have to tell you, the White House sent Missouri's plan to 49 other states and said, look at theirs.
While there's excitement regarding the vaccine and Missouri's in-depth plan, there are some challenges, first of which being it has to be stored at 90 degrees below Fahrenheit, and the vaccine has to be taken in 2 doses. The first phase and half of the second phase will be done by Missouri DHSS while using their freezers for the vaccine. The health department will become involved in the second half of phase 2 as well as phase 3, where the vaccine will be distributed regionally. In 2009, the health department distributed the vaccine for H1N1 to local providers. As of now, it is unclear if that process will be done or if the shots will be more tightly controlled.
We will be working with our healthcare providers here to either set up some pods for the first responders, for the utility workers, or we could set up the pod ourselves.
Another challenge is working towards herd immunity and getting enough people vaccinated. In order for herd immunity to be reached, 50,000 people would need to take it in Buchanan County, which is 60% of the population.
To look at why wouldn't you get one? And going back to what I said earlier, 1 is cost, 2 is it safe, and 3 is it easy to get. And so we think we're very much focused on those 3.
Mosaic Life Care's workers are set to be a part of phase 1 of the vaccine, and as of now, Mosaic requires caretakers to take the flu shot and will likely do the same with the COVID vaccine.
The frontline caregivers we certainly would be thinking that they most likely will be mandated to get the vaccine. Now, when I say that, that's not 100%. We really have to look at the vaccine and decide.
The vaccine rolling out is looking to be a true game changer and getting back to normalcy.
When the trials have slowed down from time to time for the folks who are developing the vaccine, I think that's a good thing. I think that's the process working and making sure that before we distribute broadly, that we know what we've got. And once we do, I think it's a major part of reducing the overall mortality from this pandemic.
The vaccine has been politicized due to it being election year. The safety of the vaccine has been questioned, as well as promises being made for when the vaccine become available that were unattainable.
I thought that Senator Harris's remarks were absurd and also, frankly, really dangerous. I mean, for her to be standing up there and essentially urging people, and of course she's really talking only to half the nation, and she knows it. I mean, she's basically saying to Democrats, don't trust any vaccine.
The COVID-19 vaccine has had differencing of opinion in the public on if the vaccine will be safe and if people want to take it. I went in here to Rogers Pharmacy and asked a few people one simple question. Would they take the vaccine if it became available in early spring?
I do want to take it, but I would like to see how it works on other people first.
Being at higher risk, I believe there's a lot of hype, political. The scientists have made it safe. I'll take it.
I'm going to take it as quick as it comes, but I trust Trump, and if he's got something to do with it, I'll take it.
News Press Now will continue to update you on how the vaccine will be distributed. Clayton Anderson, News Press Now.